I want to specifically break down signs based on gender or age too, just so you know. So, men, if you are out there, a lot of men will hide depression, depressive symptoms, because men are ultimately taught to be strong, not to show their emotions, not to attach to that. So they will definitely have a more difficult time of saying that they are feeling depressed or having these symptoms. But if you see them or hear them talking about a lot of physical pain, it shows up in physical pain for them. So aches and pains in their body, they'll talk about that a lot. A lot of reckless behavior you'll see in men. And when I say reckless behavior, and it's not just men, it could be drinking, it could be drugs, it could be unprotected sex, or having sex with multiple partners unprotected. It could be, like I said, running through stoplights, anything, doing something that's dangerous that you know the ultimate result could end up in death or major harm to yourself or somebody else. And then anger is another big way it shows up for men. So ladies out there, if you're surrounded by men, make sure you're looking out for those warning signs. And then for men, if you're around women, we deal a lot with guilt. So we talk a lot about guilt, excessive sleep. Okay, women tend to overeat a lot if they're feeling depressed, or not eat at all, and weight gain. All right, calm down, women. I'm not gonna go there, but that is a sign of depression too, is weight gain. Don't automatically go there. If you see us gaining a few pounds, bear with us, okay? And then most importantly, our teens and our older adults, I think a lot of times we think about our general population, Dr. Taya, but we forget about our young ones and our elders too. So our teens, especially now during the pandemic, parents, look out for agitation in your young children. Irritable, they get real irritable with you, very short, snappy, don't really want to talk. They're isolating in their rooms, not really talking to their friends and stuff as much. And they also show signs of anger too. So those are some good signs to look out for. And then in our older adults, they also complain a lot about physical complications. So a lot of aches and pains in their bodies, headaches. They may talk a lot about memory loss, and fatigue in their body. Okay? So those are some things to really look out for in the various age groups or genders when you are dealing with someone that has depression, or maybe dealing with thoughts of suicide, or within our own selves too. Okay? So just remember, these things are normal. These things show up all the time. It's when it becomes persistent for a long period of time is when it becomes a problem. I know that was a lot of information. Dr. Taya, is there anything you want to add to that?
No, I think that overview was in depth, and it was excellent. It was presented really, really well. So we're sharing this information because we do understand that we're not all surrounded around clinicians that do this type of work every day. So it's very important that the layman gets same information that we're giving out, so that if you are surrounding yourself around a person who needs support, and you are that person who is the support, and you have that rapport, which we'll get to later, with that person, it's good that you'll be able to identify what the problem is, what the signs are, so that you can be alerted right away to, even if you can't handle it on your own, to seek help further. So I wanted to talk a little bit about myths. You know, we live in a society where people are doing better with the information that is being given, but we still have work to do as it relates to demystifying some of the stigmas that are attached within most of our communities regarding depression and or suicide. So one myth is depression isn't a real illness. So depression is often limited to having sadness or some type of weakness in character. I think Shanice mentioned earlier about men not wanting to cry, right? Not wanting to really express themselves, hiding hiding behind, I'm strong, I can't. People saying that they can't express their emotions, they don't have time for that. Absolutely, you have time to address your mental health. However, depression is a complex mental health disorder having social, psychological, and biological origins. Okay, so it's not just limited to sadness. It's not just limited to weakness in character. Matter of fact, when you cry, that's not a sign of weakness. That lets me know that you're in touch with your emotions and that you're willing to be vulnerable and allow people to come in. The next myth is you can just snap out of it. How many of us have heard that you can just snap out of what you're dealing with, right? No one chooses to be depressed. It's not limited to laziness, self-pity, or grief. It's a medical condition, however, in which the brain chemistry, its function and structure is negatively affected by environmental and biological factors. So both of them play a role when you start talking about depression. It's not easy for someone to just snap out of it, to just get over it. And may I add, if you're that person that you don't have enough patience to deal with a person who's really struggling, try your very best to reach out to someone that can assist that person so that they can get the help that they need and deserve. Another myth when it comes to depression is talking about it only makes things worse. How many of us have heard that? That many have the misconception that discussing depression only reinforces destructive feelings and keeps you focused on negative experiences. Well, that's not necessarily true. When a person internalizes what they're going through, it actually makes the situation worse for them. So it would be excellent of you to be that person, that support person, that a person can just pour out their heart to, that they can share to when they're really, really struggling. A suicide myth. Only people with mental health disorders are suicidal. We know that not to be true, right? Suicidal behavior deepens. It's I think Shanice talked about it, but it has to do with the deep unhappiness that someone has. It's not just limited to you have depression, bipolar, schizophrenia. You definitely can struggle with feeling suicidal ideations, thoughts, like she said, fleeting. They can come and go. Another myth about suicide is most suicides happen suddenly without warning. The majority of suicides have been preceded by warning signs. So there are people, and this is why we're having a forum like this, that really are reaching out for your help. That's not verbalized, hey, I want to go jump off the bridge, or hey, I want to cut my neck, or hey, I want to just slice they're not giving you a plan, but they're saying, hey, I need somebody to talk to. I'm hurting, I'm struggling. And so looking out for those myths, such as suicides happen without warning, because absolutely there is a warning that comes before suicide occurs. Okay, Shanice?
Absolutely. Something you said a few things that were really good. You had made the comment, just snap out of it. Do you know how many times somebody has thought about that? Like, honestly, if you could just snap out of it, wouldn't you just do it if it was that simple? So that's one thing that you definitely do not want to say to somebody, just snap out of it. You think, yeah, I would if I could. Something else you mentioned, it was around, I think you mentioned something about suicide, that it's for people, it's around people that are feeling very unhappy with their lives or with themselves. And you talked about some other diagnoses. I just want to make sure that we're very clear that this topic that we're talking about is solely connected to depression and not people that are suffering with illnesses such as bipolar or schizophrenia, because when other things come into play, like auditory hallucinations, sometimes people do hear voices that are telling them to commit certain types of acts, and they do follow through with suicide, and it may be because of the thoughts. That's a whole different conversation and a whole different reasoning behind suicide. So I hope we're making that clear, not confusing anybody on that. Another thing I wanted to just share is like when you're getting ready, and I know Dr. Taylor, you're getting ready to talk about this a little bit, going into how to actually start a conversation, I really want everybody to think about a little bitty baby. When you are talking to a baby, normally you say, hey, little baby, you're so cute. You start talking like a baby, right? And normally educators, those that are out there that work with young children, they always tell you to talk to them like an adult in regular language because children absorb, right? So they're going to learn the way that you speak back to them. Do not do that to someone when they're coming to you about feeling depressed, about feeling low. You don't have to then drop and say, oh my God, I feel so sorry. You don't have to match them. Be your authentic self.